Hi, my name is Sherri Willis. I'm the Public Information Officer with the Alameda County Public Health Department. I'm here today with Dr. Bob Benjamin, one of our communicable disease physicians, and we're here to give you a primer on H1N1, commonly known as swine flu. So, Dr. Benjamin, why don't you start off by telling us what is H1N1?
H1N1 influenza is an influenza much like any other that we've seen before. This one is unique in that this particular strain has not been seen in 50 or more years. The reason that's important is almost the entire population is therefore susceptible.
And when did we first discover H1N1?
Well, it was back in April when an outbreak of a fairly severe influenza was first identified in Mexico.
So what are the symptoms? What should we look for?
Well, the symptoms of H1N1 or swine flu are much like that of seasonal influenza. The predominant symptoms are fever, severe muscle aches and pains, sore throat, runny nose. Occasionally there may be nausea, vomiting, and/or diarrhea.
So what should I do if I get sick?
Take good care of yourself and not infect others. Stay home from work. Don't go to school. Drink plenty of liquids. If you're getting really severely ill, you might want to place a call to your usual source of medical care.
So germs count?
Germs count a lot. This is a disease that spread person to person, generally through coughing, occasionally through direct contact. We're really asking people to practice good respiratory hygiene, good etiquette. Don't cough into your hand like that, because then you reach for a doorknob or you go say, "Hi, good to meet you," and shake hands, and you can transfer virus that way. We're asking people to cough into the kids have a great term for it. They say it's the Dracula cough. Cough into the crook of your arm. That way you don't contaminate other surfaces or other people's hands. Wash your hands frequently. Don't put your fingers in your eyes, your nose, or your mouth, especially after having contacted other surfaces.
I understand that most of the cases are mild, but for those people who actually get very sick, for adults and children, let's start with children. What are some of the warning signs that the disease may be really serious?
The symptoms for little kids are pretty much the same as for adults. The things that you have to worry about most for little kids: real difficulty in breathing. Skin or mouth or mucous membranes turn kind of bluish color. It means they're not getting enough oxygen. Kids, especially little kids, and we're most worried about kids from the infants on up to 2 years, even to 5 years, having problems with thinking, not waking up clearly, severe cough, severe vomiting, irritability. Call your doc, consider going to an emergency room if the symptoms are that severe.
And for adults, the warning signs that the disease has gotten really serious are about the same?
These warning signs are about the same. They include difficulty breathing, pain or pressure in the chest, possibly the abdomen, dizziness, confusion, severe vomiting, and for both the pediatric and adults, symptoms of flu that seem to go away and then return again but appear to be worse.
Okay, we hear that a lot, that people can't shake it off. So what should people do to prevent spreading the infection?
Basic personal hygiene. If you're sick, don't go to work. Don't go to school. Avoid public gatherings. I know that the party that you were invited to on Saturday night is going to be a good one, but don't go if you're sick. Wash your hands frequently. Cover your cough, as I said. Use the crook of your arm to do that.
There are lots of prevention steps which you mentioned, and one of them could be to get a flu shot, right?
Oh, absolutely. This season, we're going to have basically 2 circulating strains of influenza. The seasonal one, for which there is immunization. It's probably due out to late September, early October. And then the second series of immunizations will be for this H1N1 swine flu.
And this sounds this is different from what we've seen before. Should people panic?
No, I don't think so. What we've got right now is seasonal influenza, which is what people have experienced for decades. We have this new influenza strain, which appears in most folks to be quite mild, but because we're expecting so many people to be at risk of being infected, we really want them to be immunized to keep the total numbers of sick people as low as possible.
Okay, thank you very much.
You're welcome.
Hello and welcome to The Public's Health, the show that puts you, the public, back into public health. I'm Dr. Tony Iton, the director of the Alameda County Public Health Department, and this is our show. Today we're talking about a fairly complex subject that has multiple public health implications, and we're talking with Elaine Coligny from the Everyone Home program, and Elaine is going to help us better understand some of the history and the current approaches to trying to address homelessness in Alameda County. Welcome, Elaine.
Thank you. It's nice to be here.
Yeah, thanks for joining us. So, to get into this, you come from a very interesting background, from the divinity background, and that's I find that interesting. Tell us a little bit about how you went from there into this social endeavor.
I came to seminary knowing that I wanted to do what we called urban ministry, so wanted to work with the poor and marginalized and work on issues of empowerment and economic justice. And I never thought I'd be a local church pastor. So I did my field work at an organization in Berkeley that ran a soup kitchen and a couple of shelters and drop-in centers and helped out there. And I knew that that's what I wanted to do and be involved in working with the homeless and help to end homelessness. So when I graduated from seminary, a little agency in San Leandro had an overnight shelter for women and children, and they were looking for a director. I applied and got the job, and I was there for 15 years and grew the agency from one overnight shelter to 3 shelters and 53 units of supportive housing, and got very involved in sort of the overall Alameda County issues about how we're addressing homelessness as a system. I got involved in the policy issues, which is how I ended up at Everyone Home when we came up with a plan to end homelessness in this county.
Wow.
They were looking for a director, and I felt like a good fit, so here I am.
No, we're glad to have you.
Thank you.
Now, you have an interesting longitudinal perspective on this issue in Alameda County, having been involved in it for what seems to be approaching a couple decades.
That's right.
How would you describe if you will, in public health we call it an epidemic, how would you describe the phenomenon as having evolved over those 2 decades?
Sure. Well, most of us became, as a nation, we kind of started talking about homelessness in the mid to late 80s. And that's when we noticed that it was more than sort of your classic, stereotypical couple of guys in the alley kind of thing, but that it seemed to be becoming an epidemic. And what we thought we needed to do for folks was give them a place to sleep and a warm meal at night and send them out the door in the morning with a bag lunch. And assumed that folks would get the other help they needed for medical things or help with finding a job or getting income from other organizations like social services or community clinics. So when I went to San Leandro Shelter in 1992, that was about the time we turned from just having people stay overnight someplace to saying we've got to offer them more services. And so we began putting things like parenting classes in at our shelter, life skill training, budgeting classes, a depression group, searching for job help, searching for housing help. And we began looking at all kinds of needs that families and individuals had and almost made shelters into mini multi-service centers, if you will, as well. And that trend continued for some time, and there's ways in which it's very logical. Folks who are homeless have very complicated and troubled lives often.
Sure.
Some of that caused by being homeless, but some of it as part of their life story. And so we started saying, wow, it looks like there are people who are chronically homeless. They're not just homeless one time briefly and they get out. They're spending years homeless. And so by the time I got to the San Leandro shelter in 1992, for example, I was talking to people who lost their housing in the Loma Prieta earthquake in 1989.
Wow.
And they'd been moving around from shelter to shelter for that much time. I'll never forget this 7-year-old kid I met who'd never lived anywhere but in a shelter. And he'd hardly gone to school. And his mother would just bounce from shelter to shelter to shelter until she wore out her welcome and she got moved on to another shelter. So toward the mid-late 90s, we began saying there's got to be a
better way.
Different way, yeah, a better way, a different way to do this. And there are people who seem trapped in the homeless system and they're not getting out. So we started looking at an idea called housing first rather than housing ready and say, what if you take a family or an individual with a lot of complex issues, but you say the first thing they need is a consistent place to lay their head night after night. They need permanent housing. You put them in housing first and wrap them with services to support their ability to stay there and improve the quality of their lives. So that's where we are now.
So this is really a paradigm shift in terms of thinking how to approach the problem of homelessness. Get people
Absolutely.
housed first,
Yes.
and then try to support them in that housing with services, as opposed to trying to ready them for some sort of state of being prepared to hold
Right.
on to housing.
That's right.
That's interesting. We're going to come back to this in the second segment of the show. Elaine is the executive director of Everyone Home, and they have a plan that embodies this spirit of housing first. And we're going to explore that a little bit, as well as the notion of the federal government's responsibility and how much the federal government has divested itself of responsibility for paying for and investing in affordable housing. So hope you'll stay with us. And welcome back. Now, I know what you're probably thinking. Housing. Housing is so expensive in the Bay Area. The Bay Area is one of the 10 least affordable places to live in the United States, and probably in the world. And some of us are having problems ourselves affording our mortgages, and we're in the midst of a foreclosure crisis. So who are these people that think that they can now house the homeless? Well, we're sitting here with one of the lead architects of one of the strategies that Alameda County is going to be adopting. Elaine, how are you going to do it?
Well, we aren't going to do it by ourselves. So I like to say it takes everyone to bring everyone home. So it does take the community's commitment to say homelessness is an intolerable level of human suffering in our community. It's not the kind of county or community we want to be part of. But we do have some strategies, and one of those is to prevent homelessness before it occurs. It's much less expensive to keep a family or individual where they're living now than to let them lose their housing through eviction or some other housing crisis and then go through the shelter system or be living out on the streets. So we're working on prevention, helping families stay where they are and individuals. And we're also working on expanding the housing opportunities we have available in Alameda County. And we're doing that a number of ways. One of that is that we're building some housing. So there is some money available from the federal government and the state. Not enough yet, but we're hoping that will improve over the next 4 to 8 years. But so we're building apartments that, because the developer didn't have to spend as much of their own money building it, they can afford to have lower rents so that they're targeted to folks at 30% of the area median income or lower. And so that makes the housing affordable. We're also encouraging individual landlords who operate buildings to be willing to rent to folks with histories of homelessness. And we are bringing in housing subsidies. So probably a lot of your audience has heard of Section 8 vouchers. So that's one tool we have. We certainly need the federal government to make more Section 8 vouchers available. They're the best affordable housing tool there is. The tenant can choose where to live, and the voucher goes to the landlord so that they're made whole financially, and the family lives in the unit like any other family or household. But there are also some other voucher programs like the Mental Health Services Act, which we passed in 2004, has some money in it to create vouchers for persons living with severe mental illness so that they too could pay for market rate housing because it would be subsidized with those vouchers. So we're doing, and also looking at options where people may want to share housing or, probably when you were in college and certainly when I was, I lived with folks that I wasn't related to, but we
Roomies.
roomies. And so, promoting some of those strategies as well. No, we're not all going to be able to live in a nice 4-bedroom home with 800 square foot per person, as we've all learned in this housing crisis. That's not the only way to live. And so we're building more apartments and higher density housing and looking at a lot of creative ways that folks can get into permanent housing.
And so I would imagine that the Everyone Home effort is going to at some point need to assess the demand. How much homelessness is there?
Well, we've already done some of that some needs assessments. So we know that in Alameda County on any given night there are about 6,000 people who are homeless.
Wow, 6,000.
And that translates to between 12 and 15,000 in a year's time. A good chunk of those folks have been homeless for many years. As we talked about earlier, some folks spend years in the homeless system, and so there's a subset that are a static number, but there are people who are homeless only once, and they're homeless briefly, and they move in and out of it quickly, and we hope with those folks will prevent them from ever becoming homeless. But we estimate that we need to expand the amount of housing affordable to extremely low-income people who are at risk of homelessness by about 15,000 units over 15 years.
Wow.
So that's our goal, is by the year.
How much money is that for 15,000 units?
Well, this is going to be a scary number, although right now you can say the $2 billion and it's no longer scary. But when we wrote the plan,
take it from AIG.
Right, exactly. We'll just take a couple bonuses.
Right.
But when we wrote the plan, $2 billion was a lot of money, and it is a lot of money. Mm-hmm. We spend about, somewhere between $40 and $50 million a year right now from multiple sources serving the homeless population, and that's not counting what we're spending to build affordable housing. So just to manage the supportive housing and shelters we have now, we're spending about $40 to $50 million a year in Alameda County. So obviously we need to bring in more resources. We're very pleased that in the stimulus package there's a significant amount of resources for homeless prevention that we haven't had before. So Alameda County will get about $7.5 million of
that's good.
stimulus dollars to help prevent people from becoming homeless, and that's a much cheaper way to go, as I've said before. And we're looking at strategies about creating a dedicated revenue stream, perhaps through a hotel tax, the tax that you get on hotel nights, a little increase to that's dedicated to solving homelessness.
Interesting idea.
So we're looking at strategies like that, how to enhance revenues, how to maximize what we get from the federal government to do this, and the state is looking at a strategy to create a dedicated revenue stream.
So are we talking about $2 billion to build those 15,000 units and then some smaller amount of money to operate them and maintain them? Or are we talking about an annual cost?
No, that's over the life of the plan.
Okay.
So it's sort of, and when you're doing this kind of budgeting that far out, there's certainly some level of speculation. But the idea is that since the plan was launched in 2007, we brought online 500 units of supportive housing. And as we get up to scale, we'll do more in a given year. So the budgeting is sort of estimating the capital investment as well as the operating costs. So the capital investment is high at the beginning, and then the operating costs will go up a little as there are more and more units. Mm-hmm. But then it won't be $2 billion each year to operate.
Well, just for our viewers, the scale of $2 billion, the put it in some sort of frame for people, the county's budget is about $2.2 billion a year.
Right.
So that's proportionally a large amount of money. But let me ask you somewhat of a philosophical question. Is this the failure of the marketplace? I mean, you've got a demand for housing, and you've got people who build housing, and presumably the people who want housing have some resources, albeit not a lot. So conservatives would say, the market should solve this problem. But could the market ever solve this problem, given that the resources are so few amongst the people who are homeless or near homeless, and the cost of building, developing, and maintaining housing is so high? Doesn't the government have to play a role in essentially trying to match those supply and demand issues?
Well, I would say absolutely yes, it does have to play a role, and historically it has played a role. And a lot, for example, a lot of neighborhoods in the Bay Area built after World War II were built in response to the federal GI Bill, where money was made available to World War II veterans to buy homes. And the government helped the veterans' family and also supported the building of that housing. And historically, the government has built and operated and subsidized housing so that for folks who can't afford it in high markets, high demand markets like the Bay Area, it's possible to stay housed. Right now in Alameda County, if you work a minimum wage job, you'd have to work 168 hours a week, I think, to afford a 2-bedroom apartment. So
Impossible.
You just can't work hard enough to do that. This is not a bootstrap issue. This is
So is housing a human right? Is that, in essence, what we in Alameda County should be espousing and working towards?
Well, it's certainly where everyone home is coming from. It's one of the fundamental human needs, and people die on the street because they're homeless, and they get sicker and they commit more nuisance crimes, and folks' lives are harder, and our community life is poorer when we've got folks living on the street. So I think it's in all of our interest to treat housing as a human right. It's more humane and it's more economical, and it makes for better communities when we know that everyone has a roof over their head.
Well, on that note, how could we not leave it there? Elaine, it has been a pleasure, and we look forward to hearing more about the Everyone Home Plan. Thank you very much for the work you're doing in Alameda County, and I'm sure our viewers appreciate it as well.
Thank you.
So there you have it. That's homelessness in Alameda County. We need you to participate. We need you to be interested. We need to solve this problem together as a community.
Every gun you take off the street is a gun that's not going to kill somebody.
In February of 2008, our health department participated with the Oakland Police and other agencies in State Senator Don Perata's project, One Less Gun. The goal of this gun buyback effort was to reduce gun violence. The method? Give $250 in exchange for each handgun or assault rifle turned into the police. No questions asked. Critics of the project quickly took aim and fired their complaints on the editorial page. They noted, for example, that some in the large turnout were dealers who took advantage of the situation to unload junk guns for a tidy profit. How does this make Oakland safer? They questioned. In the end, over 1,000 guns were turned in that day. Who can say that none of those guns was destined for accidental or criminal violence? Now here's Dr. Tony Iton's interview with Don Perata.
All right, so thanks for doing this.
Well, thank you for helping.
Thanks for bringing us in.
Well, we can always talk about guns as being a criminal problem, but the aftermath is really a public health problem. And I'm just proud that your department has partnered with us in this thing.
Well, we're trying in whatever way we can. What other ideas do you have for violence prevention? What sort of notions are you thinking about?
I think the first thing is that the community has got to be encouraged to re-engage. There's a lot of fear out in the streets for reasons that are completely understandable. And the more people engage, are willing to do things like this, I think this is why this was so overwhelmingly successful today, is that people found an opportunity to do something, to express themselves, and they were willing to take something that they thought would protect them and surrender it on behalf of the community. We just have to build on that. If we can go back into the community, have community centers like recreation centers used to be, if we could have health clinics at our schools like we started years ago, but somehow we've had to abandon them because of lack of money. There's no paucity of ideas.
Yeah.
Perhaps the lesson from today is we better do another one of these pretty soon.
Can you give us a sense of how you came up with the idea?
Candidly, having somebody stick a gun in my face and steal my car was a factor. A young boy who was taking piano lessons across the street from where I get gas, and he was paralyzed with an errant bullet. Those things happening within a very brief period of time of one another really, I think, galvanized something in my mind, the sense of angst, the sense of desperation. But the fact is, this goes on in this community all the time. We had 2 young teenage girls murdered a couple days ago in Oakland, found in a van. 2 people were shot to death last night, and not too many blocks from here. And this goes on all the time. So for me, it was just don't stand there, do something. And my feeling is, every gun you take off the street is a gun that's not going to kill somebody.
So when you went around raising money for this, how did you pitch it? How did you get people to contribute?
I wrote a letter to what I call the usual suspects. Most people know I've been doing gun control since I've been in office, but we got a great response from pharma, the drug industry responded, Wells Fargo, Bank of America, AT&T, Comcast, people who are in the community, work in the community. And the bigger issue was just getting the money fast enough that we could convert it to cash. But there's more out there to come. This has been a success beyond any expectation at every level.
Yeah,
and the only thing that was expected is that you guys would step up and do a great job.
Hey, well,
we're
there with you. Any strange reactions?
No, the strangest thing I've heard today was the manager of Allen Arms, which is a senior retirement home here in East Oakland, collected 12 guns from senior citizens in the retirement home, 2 of whom were 90-year-old women.
Wow.
So 12 guns were in this retirement center, and people said, look, this is time for us to give these guns up.
Wow.
So that's the, you just never know.
Yeah, you really don't. Well, thank you so much, Senator.
I
really appreciate
it.
Thank you for watching The Public's Health, and we hope to see you again sometime soon. Bye-bye.